on to this afternoon's program. It's actually going to be a great program. I'm really excited by the lectures that we're going to be having this afternoon. We're going to start out strong with sort of a 50,000-foot overview of stroke by Dr. Holli DeVon from the Betty Irene Moore School of Nursing. She's one of our newer faculty. She's a great speaker, and we're really glad to have her. So, Holli, if you're here, I can't see with the bright lights in my face. Oh, great.
Today, in the next few minutes, I'm going to talk to you about the impact of stroke on patients and families. So just a little bit about the prevalence and incidence of stroke. These data will be familiar to a lot of you, but it's probably good since I was the first person speaking, I could do a little review. So each year, almost 800,000 people experience a new or recurrent stroke. About 610,000 of these are first attacks, and 185,000 are recurrent attacks. So this is a significant number of strokes. On average, every 40 seconds, someone in the United States has a stroke. So if you think about the time that we'll spend together in 10 or 15 minutes, we're talking about 25 more people experiencing a stroke. And there's about 55,000 more women than men having a stroke, so that's about 14%. I mention this because I have a strong area of interest in gender studies, also healthcare disparities, and we're going to get to that in a second as well. So blacks have almost twice the risk of first ever stroke compared with whites. You can see from this slide that 5 per 1,000 for black women compared to a little over 2 for white women, and 6.6 for black men compared to 3.6 for white men. I submitted a paper a couple months ago, and I said these statistics were a national embarrassment. And one of the reviewers said, "Wow, that's harsh." Well, the statistics are kind of harsh, so I think it's a good idea if we actually talk about the realities. So I took this slide from the Heart Association website, and I just want to call your attention to one piece of the data. So you can see that the prevalence of stroke by age and sex is pretty consistent, except one time point, and that is age 45 to 54, where women are twice as likely to experience stroke compared to men. So we have to wonder about the hormonal component to that data. So this is probably the key piece of information that really concerns us as clinicians and healthcare providers. Stroke's the leading cause of serious long-term disability. The length of time to recover from a stroke depends on the severity of the stroke, of course. But between 50 and 70% of stroke survivors regain functional independence. That's good news. But 15 to 30%, probably a little bit more, are permanently disabled. And 20% still require institutional care at 3 months after the stroke, the acute event. So through my rose-colored glasses, I construed this to be good news. I wanted to just mention awareness of stroke warning signs and risk factors. In one study, about 38% of respondents were aware of 5 stroke warning signs and would first call 911 if they thought someone was having a heart attack or stroke. Well, in the real world of patient care, they might know 5 stroke warning signs, but I'm thinking that if they called me in a random digit dial study at night, I'm not sure I could come up right away with 5 stroke warning signs. And I know from my prior work in examining symptoms in heart disease and stroke and the impact of bystanders that a lot of times patients and loved ones, bystanders, say they'll call 911, but they actually don't. Also, black participants were more aware than whites of their hypertension and more likely to be undergoing treatment if they were aware of their diagnosis in another study. However, blacks were less likely than whites to have their blood pressure controlled when being treated for hypertension. So finally, 60% of patients who suffered a stroke were able to identify one stroke risk factor. Only 55% were able to identify one stroke warning sign. these data can be a little bit surprising because intuitively we think that the signs and symptoms of stroke are fairly dramatic. Not many conditions are so dramatic as to have facial droop, aphasia, weakness on one side. But depending on where the stroke is, we see a lot of patients who don't recognize symptoms and don't seek treatment. So what is the impact of stroke on patients? Well, we know the deficits associated with post-stroke, especially on motor control, certainly extremities, hemiparesis, dysphagia, bowel and bladder issues, communication and cognition disorders, dysarthria, reading comprehension, visual scanning, attention, executive function, and then depression. One of the most underdiagnosed and undertreated complications of stroke. And depression is often an antecedent as well as a consequence of stroke. And we're not screening patients for stroke as well as we could. Depending on what study we're looking at, the reported prevalence rates for depression vary from 25 to 79%. So they're quite significant. A little bit more on depression. What happens when the stroke patient is depressed? Well, we see sequelae like diminished recovery. We see less functional gain in activities of daily living. We see increased risk for subsequent cardiovascular events. We see increased healthcare utilization and increased mortality rates. Now, what are some of the risk factors of depression? This looks similar to many other conditions, not just stroke, but we know women are at a higher risk and report depression more often than men. Premorbid depression or other psychiatric illnesses can be associated with increased risk of cardiovascular events, including stroke. It's associated with social isolation and functional or cognitive impairment. I want to talk a little bit about health-related quality of life. The presentations that we've seen in the last 2 days have been fantastic, and many of the presenters have talked about studies in which we look at physiological measures like velocity and lumen size and patency and mortality rates. And some of the speakers have even alluded to the fact that Medicare Services is asking us to look at outcome variables that nurse scientists are really good at measuring, things like symptoms, functional status, quality of life, and health-related quality of life. So variables that have been associated with reduction in health-related quality of life for patients with stroke, again, are female gender, older age, poor physical functioning, comorbid conditions, and which one of our patients doesn't have multiple comorbidities. A history of depression prior to stroke and after, paresis of the dominant arm, institutionalization of the stroke survivor, poor family functioning, lack of social support, and initial perception of poor quality of life prior to the acute stroke. Then I also want to shift over to caregivers. Of all the environmental factors listed in the International Classification of Functioning Core Sets for Stroke, this is a publication from the World Health Organization. Experts judged family support as the most important. This is probably not a surprise to anybody in the room, how important families are in recovery of stroke survivors. Families care for approximately 74% of stroke survivors after discharge to the home setting. And evidence is emerging about the vital role of family during the recovery trajectory. Now, it's not that we didn't already know how important the family is in recovery. It's that we're now collecting data to support the importance of family, including the association of family support with improvements in stroke survivors' physical and overall functional status and psychosocial outcomes. So we're talking about both physical, mental, emotional, psychological outcomes. Now, not surprisingly, family caregivers are also at risk for depression, social isolation, declining health, and mortality. Depression prevalence in stroke caregivers has been estimated to range from 30 to 52%, and higher depression rates in caregivers than in the stroke survivors themselves have been reported. So what are some of the things that caregivers of stroke survivors experience? Not surprisingly, less time for family and social activities, poor relationships with friends. You can't be a very good friend when you don't have time to invest in the relationship. Worse financial and emotional well-being, lower energy levels, poor physical health, higher mortality rates when experiencing strain. So I think the take-home message is it's imperative to support family caregivers. We sure don't have very much time to spend with the patients. So we have even less time to spend with the caregivers. But it's very important and has direct benefit to our patients. So a couple recommendations for patients. Not surprisingly, there's guidelines-based care for acute and chronic phases of rehabilitation. I recommend those of you who are interested in this look at this article. These are the guidelines that were written by the Comprehensive Overview of Nursing and Interdisciplinary Rehab Care by the American Stroke Association and Heart Association. It's a very good article. And then recommendations for caregivers. Healthcare providers should respond not only to the needs of the stroke survivors, but also those of family caregivers throughout all phases of the rehab process. We have a lot of data now indicating that we can do very intense rehabilitation early on after the acute phase. It's been shown to be very beneficial. Also screen caregivers for depression, and then refer caregivers to health care and community resources. We know centers of excellence are well-equipped interdisciplinary centers to provide best care for both survivors and caregivers. So I want to tell you that I had very few slides. I had quite a few more, but nurses are very good at not providing a lot of slides and going over time. So I'm going to take this opportunity in the few remaining minutes to do something I've never done as a professional before, and that is to talk about my experience as a caregiver. So this is a photograph of my family. And my mother, I would say, was one of the greatest stroke survivors of all time. I was an ICU nurse, and she was 46 years and 6 days old when she had a massive hemorrhagic stroke. I had been a nurse for 15 months. I had virtually no knowledge whatsoever, and it didn't really matter because at that time I was a daughter, I wasn't a professional nurse. But if you think back to the slide that I showed you about risk factors, just to remind you the variables that are associated with reduced health-related quality of life, older age, female gender, poor physical functioning, comorbid conditions, this long list did not apply to my mother. At 46 years of age, she was a very vibrant young woman. She had undiagnosed hypertension, not surprisingly. So what I wanted to say was my sisters and brother and I, it turned out we became pretty darn good caregivers. We didn't have a how-to manual, but we put our best foot forwards. And one thing that I would recommend as a caregiver is that we all stepped up and we did what we were really good at. So I became my mom's healthcare expert. Took her to all her appointments, arranged for appointments for all of the problems she had in the remaining 32 years of her life. I managed that. My brother managed all kinds of repairs and things around the house, and my sisters did shopping and things like that. So I really just want to say it's quite possible to have very good outcomes despite significant disabilities. And her main disability was hemiparesis on one side. But she taught me a lot that I I took to my patients and students over the years. She taught herself to do things that to this day I can't believe that she was able to do. So thanks again for giving me the opportunity to talk. Today, in the next few minutes, I'm going to talk to you about the impact of stroke on patients and families. So just a little bit about the prevalence and incidence of stroke. These data will be familiar to a lot of you, but it's probably good, since I saw I was the first person speaking, I could do a little review. So each year, almost 800,000 people experience
on to this afternoon's program. It's actually going to be a great program. I'm really excited by the lectures that we're going to be having this afternoon. We're going to start out strong with sort of a 50,000-foot overview of stroke by Dr. Holli DeVon from the Betty Irene Moore School of Nursing. She's one of our newer faculty. She's a great speaker, and we're really glad to have her. So Holly, if you're here, I can't see with the bright lights in my face. Oh, great.
It's a newer recurrent stroke. About 610,000 of these are first attacks, and 185,000 are recurrent attacks. So this is a significant number of strokes. On average, every 40 seconds, someone in the United States has a stroke. So if you think about the time that we'll spend together in 10 or 15 minutes, we're talking about 25 more people experiencing a stroke. And there's about 55,000 more women than men having a stroke, so that's about 14%. I mention this because I have a strong area of interest in gender studies, also healthcare disparities, and we're going to get to that in a second as well.